Welcome to episode 11 of the American Tributaries podcast, where to break out of the bubbles we've all been living in these last few years, we are using modern technology to explore the various currents of people in our great country. I'm your host, Michael Whidden. Today, I'm so very happy to be joined by Dr. Jacqueline Subka. Jacqueline is a dentist in Thousand Oaks, California, which is a city located between Los Angeles and Santa Barbara. She's been there for a little over 2 decades. Jacqueline was actually connected with me by a guest from episode 2, Dr. Deborah Bass. So, Deborah, thank you so very much for joining us. And Jacqueline, thank you so very much for joining me. How are you doing today?
I'm doing great. How are you?
I'm doing well, thank you. We've had a lot of rain and cold weather here the last few days in New York. I don't imagine you see much of that out there.
Not here, no, but we did have a little bit of rain recently, but it's been windy and hot the last few days.
Nice, nice. And how you've lived there most of your life, or
I've lived in the Thousand Oaks area since 1999. I grew up in
okay,
San Diego.
okay, great. So you moved north,
Yes,
but I'm sure it's similar weather.
very similar, very similar.
Okay. Okay. And what led you to the Thousand Oaks?
It's where I bought my practice, so that's why I moved
Okay.
here.
Okay, great. And how long have you been a dentist in total?
I have been a dentist 25 years.
Wow.
I know.
And is that it goes quick, right?
Right.
And were you practicing then someplace else before you acquired your practice up there?
Yes, I practiced as an associate in an office out in the middle of the desert for almost 2 years.
Wow. And how does that work? So like I guess can you describe the path for becoming a dentist?
Sure. I have an undergraduate degree, which is a pre-med degree from UC Santa
Hmm.
Barbara. And after I did that, I took the DAT, which is like the MCAT just for dentists. Got into a dental school, which is a 4-year program. I went to USC. And after I finished that, I took my boards, got my license, and I got a job as an associate in Ridgecrest, California, which is very close to Death Valley.
Ah, wow. So was it a slower pace of work being, I guess, in that setting, or was it because maybe you're the only dentist in the area, it was pretty busy?
Well, it was actually quite busy. There's a few dentists out there, but they don't have any specialists. So I got a lot more education on the specialties because there wasn't access to endodontists, oral surgeons, periodontists. Everything had to be done in house because there just wasn't anybody close by.
So you really had to kind of be a jack of all trades.
Correct.
Wow. Great. It's actually like being a lawyer. I was talking to a friend in a prior episode who was a lawyer in New York and then moved to Wyoming. And like in New York, you can be like hyper specialized, but as a lawyer in the middle of Wyoming, you really had to be able to do everything.
Correct. So
That
it,
was
it it
interesting to
worked
hear.
really well for me because I have used everything that I learned out in that setting in my own office. I do a lot of specialty things in my office that most general dentists don't do.
Hmm. And when you were in college, did you know that you wanted to go into dentistry or just somewhere in medicine, and that became a focus later on?
Well, interestingly enough, I originally wanted to be a veterinarian. That didn't work out really well for me because I'm allergic to cats. And there's in the state of California, there's only one veterinary school, and that's UC Davis. So it's very competitive to get in. So I switched gears, and then I wanted to be an airline pilot. So I went to Embry-Riddle Aeronautical University for a semester, and the path to get to commercial liner jets is very costly unless you go into the military. Unfortunately, at that time in the military, they didn't allow you to fly if you had corrected vision. So that was kind of ixnayed.
Hmm.
And then, last minute when I was, I guess it was my last semester in UC Santa Barbara, I decided to volunteer at the dental clinic just to see what it was like. And that was it for me. It just was something that fit very well. I'm very mechanically inclined, and I thought it would be a good option. So I took the DAT, and the rest is history.
Wow. Now, when I picture, I mean, it always seems that like with dentists is that people kind of pay short. They don't pay enough attention to their teeth, and I think then you'd also just maybe not pay as much attention to like a dentist. But there's what I've heard is like really, I mean, a lot of your health can be driven by what's happening in your mouth, or at least can be kind of told you can see a lot from what's happening in somebody's mouth. Is that indeed
Absolutely.
the case?
Absolutely. There's a lot of correlation to overall health and the way people care for their health. Plus, there's a genetic component that we can see. So, there are tendencies for people that have periodontal disease, it's passed down in the generation. So, there's a lot of things we can do to intervene those processes if we know family history. But we can see things like people that deal with acid reflux, we can see the implications in the mouth and get them sent to their doctor, their physician to have that cared for. The other thing that we see is I have a CT scanner in my office, so technology is a big part of what I do. And I have been able to find blockages in people's carotid arteries before they had any idea and refer them to the appropriate doctors to have those things checked and rectified before they have a major problem. So that's one of the really neat things that I have implemented in my office that has bigger not consequences, but bigger effect on the whole picture of the patient's health than just making sure they brush and floss and taking care of fillings.
The artery you mentioned, where is that? Is that the one in your neck?
Yeah, on the neck here,
Okay.
which is
Oh
the one
wow.
that typically causes people to have strokes. If you get a blockage
Oh.
here, blocks the blood flow to the brain, and you
Hmm.
get a stroke.
Okay. Wow. And then I guess one of the things that I know my dentist, I guess, has scolded me for years, but then I finally stopped during the pandemic. Was I don't bite my nails anymore.
Oh, bad one.
So so I'm proud to say that. But how bad is biting your nails for like your teeth and just for your overall health? I mean, sometimes you hear like just I don't know. I think instinctively it's like telling your kids to like not sit too close to the television. But I think some of that is just kind of based on I don't know. That's what you're supposed to say. But like as a dentist, like how bad is it to be biting your nails? What are all the
Well,
different health implications?
the big problem with biting the nails is the wear that happens on your teeth. It causes premature wear, and you wear off the enamel early, and you can end up with sensitivity. Plus, your teeth get shorter, and you can have bite issues or fracturing of the teeth. I ironically used to be a nail biter myself.
Mhm.
Stopped it. It's not an easy habit to stop, but it's
Right.
definitely there are worse things that you can do. Chewing ice is got to be one of the worst habits that people have.
Really?
Yes, it's very good for my business because I end up doing a lot of crowns or extractions because people fracture their teeth and end
Mhm.
up in pain. So, luckily now we have options of implants and things like that, which are less destructive to the surrounding teeth and tissues, but a lot more costly.
I didn't realize that like chewing ice would be that, and that would be that problematic. Are people chewing like big chunks of ice, or is that just like a nervous habit that people have, and it just is more likely to cause a problem than other things?
It's a very common thing that people do. And
Hmm.
when I see people that do it, they end up having a lot of crowns in their mouth because they break their teeth.
Is this just like the small chunks of ice you get out of like the soda fountain, or are these more like the bigger chunks of ice you get in your glass as you're slowly drinking your soda or juice or whatever?
Everybody has their different preferences. Some people like
Uh,
the shaved ice, which doesn't seem to be as detrimental to the dental tissues, but
mhm.
definitely the harder pieces of ice can cause fracturing. But
Wow.
chewing gum is a bad habit too. I mean, because
Really?
it causes wear to the TMJ, which is the joint by your ear. So you're doing
Hmm.
premature wear. And so that can have long-term implications. So there are people that are do other habits like sucking their thumb when they're younger.
Hmm.
Some people do it when they're older too, and even tongue thrusters. There are people that have the habit of pushing the tongue against their front teeth, and when they do that, it produces an orthodontic movement that'll actually move your teeth forward. We can correct it orthodontically. I do it all the time in my office with Invisalign. The problem is if you don't stop the habit, the teeth will be pushed back in that protrusive position.
Wow. I'm scared to ask you about how much damage coffee and wine do to your teeth.
That's mostly just staining, which
Uh,
is easier to correct, but there is acidity associated with wine and coffee. So you've
mhm,
heard of some of the products they have to reduce the acidity in your mouth. There's toothpaste that you can use that help to neutralize the acids, but it's
mhm,
mostly staining
mhm.
and some wear from the acids.
Now, are these all the kind of questions that you get when you're at a cocktail party and somebody hears that you're a dentist? Am
Usually, I get the, "Hey, I have a question for you about my son." Billy, come over here. Show her your teeth. Does he need braces? Stuff like that. Or people will do this to me, look at this. What do you think?
Well, it's funny. I feel like my children have all been kind of eager to say like, "Oh, I need braces. I need braces." And I feel like when I was growing up, like back in like the '80s, it was something. I guess I don't think people necessarily wanted as much, and I don't know if things have changed, or maybe I just was never in tune to it, but they seem eager to get braces, and we're always like, "Look, hold on, we're footing the bill now, so let's just hold your horses. We'll let a professional decide."
It's true. I have a lot of kids that are upset now if they are told they don't need braces because they have
Uh,
all the different colors and things that the orthodontist put on to encourage the kids to want them, and
yeah,
and it's
they
become
succeeded.
a thing that everybody wants to be a part of.
Wow. I'd read this book. I think it was called The History of the Human Body. And in this book, the one of the things the guy was talking about is how like with the way humanity like lives these days we're all kind of like we have our bodies are made for like a style of life that's thousands and tens of thousands of years old. And you're saying a lot of the things that we do now are just kind of like patchwork, patching up problems that if we like dug a little deeper and changed how we live would be a better solution than just kind of patchwork. And one of the things, and I might not be totally remembering, but he talked about braces, and he had said that one of the issues with braces is that our jaw was meant to chew harder things and to chew more, so that in this day and age we tend to chew softer things, so our jaw and our I guess our gums or jaw don't get the exercise that they would to have a strong enough jaw to have the teeth go into place. Is that something you've ever heard before?
I haven't heard that, but there has been a recent shift in orthodontics. Now, I'm not an orthodontist, but a
Hmm.
recent shift in orthodontics is when I was younger, they would typically take out teeth when people were crowded. They would take out the bicuspids to make room
Hmm.
so that they could straighten teeth. We are really shifting away from extracting teeth now to make things straighter because that was more of a cosmetic concern. Now there's a big push for making sure you have an open airway. So when you take out teeth and they actually shift everything back to make things straighter, it closes the airway a little bit. And so there's a lot more push to keep the teeth that you have to keep everything open for better breathing,
Hmm.
because we've seen problems with people developing more snoring habits or sleep apnea, and they're seeing a lot of association with people that have had their teeth extracted when they were younger for orthodontics.
Wow. And then I guess, and maybe the following question would be: would you see that there could be problems from somebody from eating too many soft things, like having smoothies and soft pasta, and not like exercising your jaw with like red meat and other things like that, or do
Not
you not see
typically.
the
We don't see
connection?
that. We'll see that
No.
from people that do too much or they grind their teeth. We can see
Hmm.
mostly it's from grinding or acid reflux, which will wear and make erosions. Like I can tell if a person is bulimic based
Hmm.
on the wear I see on the backs of the front teeth, or if they suck on lemons as a habit. So those are detrimental things that I can pretty much tell if they've been doing it for a little period of time that they do it. So sometimes it
Hmm.
brings up an interesting dialogue with patients as to, do you have an eating disorder? And they look shocked when I tell them that. And how do you know that? Well,
Hmm.
I see the wear and the patterns of your teeth.
It's interesting because I guess it seemed to me that like you're real. I mean, if we think about it as human beings, like our mouth is really exposed to everything. So what's interesting is that I think even though dentistry seems to be an area where you really might almost see the first signs of problems, I think you're always raised to kind of think like there's your medical doctor and then there's your dentist, and
Yes.
there's like a big wall between the two of them, whereas it almost seems like the dentist and your like general practitioner should be in somehow in kind of communication about the health of the person.
And I'm seeing that being better in recent years, especially with technology. Like I said, the CT scanner in my office, I've referred patients to their physician to have their carotid arteries checked. And the doctor will say to the patient, well, how did you know about this? Well, my dentist found it on a regular cleaning and examination, a regular recall examination. They tend to be fairly surprised, but impressed. And yet, when I have patients that go to the hospital for extended stays, they aren't being encouraged to take care for their teeth when they're hospital. And I can see a lot of problems when they get out of that situation. They end up with swollen gums, inflammation, sometimes a lot of buildup of tartar or even decay, because in the hospitals they give you these little sponges because people have dry mouth that are covered in sugar, but they're
Mm,
not brushing their teeth. And unfortunately, to me, a physician needs to know the overall health of the body, which includes the mouth, and they tend to neglect that.
mm-hmm.
And I see the repercussions of that a lot when patients have extended stays in the hospital and they're not caring for their teeth.
I must say I don't think that I flossed at a day until I was probably in my like teens or 20s.
That's
And
typical.
I cringe to think. Is that right? That's
It
typical?
is. When I tell patients that they have young children that they need to floss their teeth, they're like, but why?
Uh,
Those teeth are just going to fall out.
yeah.
Okay, well, if you get large enough cavities in your primary dentition or your baby teeth, it can actually extend to the developing teeth down below. And you're
Mm,
also trying to encourage good habits that the child will carry on as they get older. Because the worst time for kids is in their teenage years. Probably the absolute worst is when they go off to college and they don't have mom and dad telling them to brush and floss and do all that stuff. I have kids
mm,
come back after their first semester or second semester in college and they have 25, 30 cavities
wow.
because they're free. They don't have to deal with it anymore. Mom and dad
well,
aren't there.
well, let's be honest. That might not be the worst thing they're doing to their bodies when they're away at college for the
Exactly.
first time. That might be the less least serious
The
thing.
parents don't like
Uh,
the bill though.
Yeah, no, I'm sure. One of the things I recall with like the flossing is also like, I mean, you were talking about gums, and if I recall correctly, like, I mean, can you get infections and like, can you do damage to the rest of your body if there's an infection or your mouth is bloodied and something gets into the bloodstream from there?
Absolutely. That's why some
Uh-huh.
patients that have had artificial joints placed need to be pre-medicated with antibiotics during a certain period of time after they were placed, so you don't get a condition called bacteremia. And the most prevalent time for that to happen is when you're having your teeth cleaned, because you're really stirring up the bacteria in the gums and it gets in the bloodstream and then it will go into that joint and cause an infection.
Wow.
The other thing
Ugh.
is people neglect is when they have a big cavity that turns into an abscess. I have known of two patients that have been hospitalized and almost died because the infection spread to their brain. So it's really scary. People go, well, it doesn't bother me. I have a broken off tooth. Some people, it's painful. Some people, it isn't. Once the tooth is dead, there are a lot of people walking around with broken off teeth that are infected. But you can end up with a major life threatening infection from a dental abscess. And it's
Wow.
pretty darn scary.
Mm. I want to, and there's more that I'd love to talk about there, but one thing that is always on my mind when I go to the dentist is, it's always I always enjoy the talking, but I think everybody's always encountered that position where like your mouth's wide open and the dentist or the hygienist asks you like a question and they're talking and you're like, I want to talk. I can't. So I try to remember what I'm supposed to say, but by the time the things are moved, I can't say anything anymore.
Right. That's a trick just to get people to stop talking so we can get our work done is we shove a bunch of stuff in your mouth.
Okay. All right. The hidden trick is revealed.
I've gotten really good at understanding people when they have hands, fingers, anything in their mouth. It's
Ah,
actually a talent. I don't know if you've seen that game that they have with the cheek retractors. I almost
yes,
feel like I'm cheating when I play that game.
because you can
I
understand a lot.
remember pretty well, yeah.
um, there was something struck a chord with me when I was at my last visit, and the hygienist or the dentist had said like, you should get like one of those water picks for your teeth, and like, I was like, okay, sure, we should get that, but it seems kind of an interesting, I guess, for maybe you might have a view in this, an interesting view in this, like with dentistry, is that sometimes I feel like there are things where like we don't get like basic healthcare necessarily right in the US, and we don't necessarily get even basic dental care. Like we can talk about advances in dental care, but I'm sure if you surveyed people, they don't necessarily need like multi-million dollar machines and stuff. They just need to like brush their teeth twice
Right.
and floss, right? Like, if sure if you did that, that would be much better for the advancement of dental health than a lot of the multi-million dollar machines and even more expensive investments and advancements that are made. So, I mean, am I off base on that, or is that true?
Not at all. There's a lot of less expensive aids that we have that can help people in um, lower socioeconomic areas. Just fluoride in the water. The problem is now we have the population tends to like bottled water. Bottled water isn't fluoridated. The fluoridated water is in the public water system. So there's been kind of a shift where people aren't getting fluoridated water, which is better for children when they're developing. It actually helps adults too. But just fluoride toothpaste is great, fluoride rinses, but fluoride varnish in my office is something I recommend all patients get every 6 months. It's a topical application, but it really reduces the amount of caries or decay that I see in my patients tremendously. But just brushing and flossing, even if you don't have access to fluoride, is the key. It really is the key
Mhm.
for most people. Is just regular cleaning of your mouth.
And it would seem to me that also, like, just that the health habit of, like, okay, if you can and I used to joke about this because I felt like I'd be like 24, 25, 26, and people asking, like, when are you and your girlfriend or your wife gonna have babies, and I'm like, I can barely remember still to brush my teeth twice in the same day. But I do think that it's like there's almost like a discipline to, like, if you can successfully most of the time brush your teeth and floss twice a day, that also is a level of responsibility that I think is, like, pretty good. Like, good on you. If you can do that, then now you're ready for bigger things.
That's true. That's true. You were talking about water picks. Water picks are
Yeah.
one of the best devices out there. I recommend them to all my patients to keep their oral hygiene in good condition, especially
Hmm.
if they happen to have a lot of dental work. It helps
Hmm.
to keep things very clean. I almost mandatorily tell my patients that have had implants, you really need to invest in a water pick to maintain implants. There's a lot of misinformation out there about implants. People think, oh, I don't like my teeth. I'm having a lot of problems. Pull them all out and put implants in, and I never have to do anything again. Well,
Hmm.
that's not really true. Implants can suffer from the same ailments that teeth can, maybe not cavities, but periodontal disease, which is the loss of bone and infection in the gum and bone, can affect implants as well if you don't cleanse them and take care of them.
Hmm. Well, and that seems to be like almost a more general principle for, like, medicine. Like, it would seem to me that with, like, I guess in the medical world, like, sometimes it's people think, oh, I should just get surgery or I get this taken care of. But as I got, like, just a very minor surgery on, like, a toe for arthritis, and, like, the toe's not really that much better than it was, and I'm probably better that I did it. But it seemed like the idea of, like, getting cut open or getting stuff replaced or whatever is, like, that should be like a last resort. Like, it's better to kind of take care of the fundamentals and get the good habits than it is to just kind of go to the doctor and go to the dentist or wherever and have them pull out your teeth,
Yeah,
is what you're saying.
absolutely. Everybody wants the quick fix today. But
Right.
I mean, I can do some amazing things with restorative things, whether it's implants or orthodontics. I can do some incredible things. But
Hmm.
if I do a crown, it's never going to be as good as what you already had. It's better than something that's damaged for certain, but and you still have to maintain it. I have patients come in and I tell them, oh, you have a cavity under your crown, and they say, how can that be? It's a crown.
Hmm.
Well, it's not the crown that's the problem. It's where the tooth and the crown come together is vulnerable. We call it the margin, is where they're seated together. And
Hmm.
obviously the crown won't decay, but the tooth still can. But it's amazing how people think, well, once I have a crown, I'm done. I never have to worry about it again. Well, that's not really true.
So when you're dealing with, like, more complicated dental issues, how much of that is, like, genetics versus just, like, poor dental work? Like, I know that I'm doing this because they don't brush their teeth versus, like, yeah, they just got bad genes.
Well, you know, it's hard to tell because sometimes it's
Right.
compounding issues. They could have bad genes and they're more predisposed to problems, and then they don't brush and floss on top of it, which makes it
Hmm.
even worse. So,
Hmm.
and then a lot of people use the cop out. Oh, well, you know, my mom had bad teeth, so I'm going to have bad teeth. So why even bother?
Yeah.
Well, like if your parent has heart disease, you know, you're not going to go around eating a whole bunch of fatty foods and a lot of red meat and all that kind of stuff. You have to adjust your diet to try and help the situation.
Right. Right. Um, So what is like the best part? Like if you're pitching for a sophomore in pre med at University of Santa Barbara, what would your pitch be for becoming a dentist versus other parts of medicine?
Well, I love dentistry for me because I'm mechanically inclined, and I
Mm-hmm.
have implemented a lot of technology, like I said, in my office. I have the CT scanner. I place implants. I do extractions. I do bone grafts. I do Invisalign. I do same day crowns. I have a mill in my office where I've gotten everything's digital. I do digital impressions. I don't know if you've ever had any crowns works done in your mouth. We put that goopy material in your mouth. We don't do that in my office. We do digital imaging. I mill the crown out of a block of ceramic. It's in, there's no temporary. It's one appointment and you're done. And the fit is incredible. I mean, I just love what technology has done to change my practice in 25 years. It's a completely different place. But I love that things are constantly changing. Um, I always say I could never be a hygienist. To me, that's boring, repetitive, monotonous. You do the same thing. Yeah, it changes a little bit with every patient, but I would be bored. It's like painting the Golden Gate Bridge. You know, you get to the other end and you start over again. I like dentistry because I can do as much as I want and get as complicated as I want, or I can tone it back. So I love to do extractions, and part of it's because of my history of being in the desert and we didn't have access to specialists. So I love to do extractions. For me, that's fun. I love to place implants. Probably my favorite procedure in my office is to place implants. But there's a lot of dentists that don't like doing that and they refer that out, and you have that option. You just have to make sure that you're doing it to the standard of care. If you're doing something that's typically done by a specialist, you need to make sure you're doing it to the same level that a specialist would do it. So I like the variety.
Mm-hmm. Do you need to be so I guess do you need to be certified to for any of those like those specialties that you mentioned, or could you just be a general dentist and do everything that is usually referred to a
You
specialist?
can do
Okay.
anything, but like I said, you are going to be held to the level of the specialist. If there's ever an
Right.
issue, you need to make sure you're doing those things correctly.
Sure. Okay. And I guess do you ever have like dental emergencies, or is it not really there? I mean, there's some where somebody's like, oh, I need to come in now, or like somebody you do.
Absolutely. I mean, I am
Yeah.
on call for myself. If I have to leave for a weekend, I have to get a colleague to be on call for me because you have to have somebody that's there to care for your patients if there is an emergency. Um,
Mhm.
I'm fortunate I'm in an area where I don't see a lot of them, but it does happen. I mean, I have patients call me and their face is swollen, or they broke a front tooth and they're going to a wedding the next day.
Mhm.
There's different kinds of emergencies. There's pain emergencies and there's cosmetic emergencies. There's little kids that get hit in the face with a baseball bat. All those kinds of tooth gets thrown out of their mouth and we have to get them back in. So there are emergencies, but there's a vast array of what those things are.
Can you ever have like other like life threatening emergencies with teeth, or does it not? I mean,
You can, like I said, I've had
yeah.
infections that have spread to the
Uh-huh.
brain. I've had
Uh-huh.
patients show up in my office and their neck is swollen and the airway is being compromised. And I have told those patients, go straight to the ER, you need IV antibiotics. So that's about it. I mean, I rarely do I see those things, or I have patients that come in that are swollen and I get them on antibiotics. But when I prescribe antibiotics, it's an oral um, tablet that they take, and it takes a good day and a half to 2 days to work. So by the time it gets in your bloodstream to fight that infection, it could get worse, and I'll have to give them instructions. If it gets worse, you notice the swelling is getting bad, go straight to the emergency room.
Wow. And what would you say is I guess the worst part of being a dentist? And I say that because I think it's easy to look at any occupation. I mean, you could look at like watch a chef on television, be like, oh, I want to be a chef. But it's like, to become that famous chef or just become a chef, you got to pay your dues. There's a
Yes.
lot of like pain and anguish. There's like knife cuts and burns and angry chefs yelling at you on your way up. So like, what are the hurdles, or what are the obstacles? What are the things where you're like, you know what, it's not for everybody because of this, and this.
A lot of people are very anxious and they don't like coming to the dentist. And sometimes their demeanor is because they're afraid. They're worried about what they're going to hear. It's been a long time. They're concerned about pain. A lot of people don't like the sound of the handpiece. So, managing the patient's anxiety sometimes is difficult. And sometimes people come across as being anger and nasty. They get really upset, and that's how it's manifested in their personality when they come into my office. So, that can be difficult sometimes. Um, and then a lot of times patients don't want to deal with paying for any treatment. So sometimes I get into situations where I'm giving patient a treatment plan. And the nice thing about dentistry is sometimes there's options. I mean, we can go all the way from taking a tooth out and not replacing it, putting an implant, putting in a partial denture, maybe even a temporary flipper. So there are a vast array of things that we can do. But each of those options have different benefits and different risks. So sometimes we have to go over all those things. And a lot of times people just say, well, I don't want to pay for anything. Or the other big thing that's a big problem now is dealing with insurance companies. So insurances don't like to pay for anything, and a lot of times they will deny a certain service, and they tell the patient that according to them it's not necessary treatment. And it really irritates me as a healthcare professional for an insurance company to dictate the appropriate treatment, which they haven't seen the patient. They're doing it based on records that I sent them and maybe some x rays, which doesn't tell the whole picture. And then I have a patient sometimes that will be upset and say, well, my insurance company says I don't need it. Well, that happens in healthcare too. I don't like insurance companies dictating treatment and telling a patient they do or don't need anything, especially when most of the times they aren't even healthcare professionals that are making those decisions. They're just people that have been told, hey, we need to cut the fat and we're not going to pay for anything, so deny these services.
What do you? I mean, there. I think because, and I think growing up for me, like the perception is like you go to the dentist, you have to go, but you. I think with general health care. I mean, even seeing like your general practitioner, people don't necessarily do, and you obviously mentioned that you people associate pain with their dentist. So there's a lot of reasons why people kind of overlook it or kind of like look at it like in a frustrating way. But um, that being said, they sometimes still have to spend the money, and you hear, I'm sure you hear about the people who like go to Mexico or go to other
Oh,
countries
yes,
to get their dental work done because hey, you can get it for $300 versus paying $1,000 here.
correct.
And on one hand, I'm sure that you would say no, don't ever do that. But on the other hand, I know, like, I can imagine, like, there are plenty of people who are like, just like, I don't have the money to do this, so my next bet is to go to San Diego, to go to cross the border and get somebody to do it. So, like, how often is that the wrong decision?
Well, it depends on what you're having done. So when the pandemic hit, I actually had a patient come in my office that had gone down to Mexico to have a bunch of implants placed. And during the process, she couldn't get back across the border to have more treatment done, and she was in temporaries. And her oral tissues were infected, very bad condition. And they were implants that I had never seen before, because they have different regulations down there. And there wasn't a lot that I could do to help her. And she was very upset. She says, because I can't get back there to finish the treatment. And she had a lot of complications. And when you go from one doctor to another doctor, let alone from another country, you know, a lot of people here wouldn't want to pick that up because there's liability issues and how do you deal with that? I was able to temporize her a little bit, but I said there, she said, can you finish me? I said, no, I don't even know what kind of implants those are. And I wasn't happy with a lot of the treatment that was done. She needed to have things completely overhauled. So I referred her to a specialist that does full mouth reconstruction. But she ended up spending a lot more money because she had it done in Mexico and had to have everything undone that was done there and redone here. So it almost not quite double, but it was more complicated than if she had actually
Mm,
started with the treatment here. Now the pandemic is a whole different, can of worms that we don't
yeah.
typically deal with. But there are a lot of problems when you do that. I've had other patients that have gone down to get a single implant or two or three implants, but they didn't want them to do the restorations on the implants. They had them place the implants. And then they come to me and say, I want you to put the restorations. I said, I won't do that because I didn't do the initial treatment. I don't know what kind of implants they were. I don't even know if I have access to the materials that we need to restore them because they all work together. There's different screwdrivers and different screws and different parts. I said, I won't do that. And they said, but I don't want them to do it. I said, well, I'm sorry. I mean, I could have helped you if you had talked to me before you had that treatment done, but you're kind of stuck, I think, going back there to get the restorations. They said, but I'm trying to save money and I didn't want to spend that up here, but I don't like the way they do restorations down there. I go, well, I'm sorry.
Are there other? I mean, is it just countries that you're going to for like I guess the bargain work, dental work that are the problems, or could be like would it apply to somebody who's gotten some work done in Canada, or is it or are there just certain countries where you're just like no way I'm not touching this?
Well, I don't like to finish work that another doctor has done, regardless if it's from another country or not. I mean,
Right.
rarely am I going to do something where it's been started at another dentist and I'm gonna finish it in my office. It's just too complicated, and there's too many lawyer issues associated with that in our country, at least, unfortunately. Um, but yeah, there most people will go to Mexico because that's where it's cheaper. I don't
Mhm.
see a lot of. I have patients that actually come to me from Canada. I have about 4 patients that come to me from Canada because they don't like the treatment they get because it's a socialized medical program, and they haven't been happy. And I've had a few people come to me from Europe, but Europe is pretty good. But there's also different cultures associated with dental care, at least. In France, nobody likes to go to the dentist. They don't like it at all. It's kind of faux pas. And in England, people don't like to get their teeth straightened. So there's still modern societies in modern countries, but there's still a stigma associated with having dental care done.
Interesting. Wow. So what do you do when you're not involved with dentistry?
Well, I have a 15-year-old daughter who is learning how to drive now, and that's been fun.
Hmm.
And she rides horses competitively, and I also am riding too, when I'm not falling off, at least. But we spend a lot of time at the barn. As you know, we're friends with Deborah and her daughter, so her daughter and my daughter were compete a lot together.
And how long have you been? What's the proper? Is it equestrian or what is the proper terminology for talking about horse
She's
riding?
equestrian. We're not in dressage. She's a hunter jumper, so we like to jump horses. Some of it is for style and aesthetics and good form, and then the rest is speed and not
Hmm.
knocking rails.
And did you grow up with horses, or is this a new thing for
I
your
grew
family?
up riding horses, but I never had a horse of my own. So I'm
Hmm.
kind of
And
reliving my childhood dream with horses that I own.
wow. And how long have you had horses?
My daughter is, let's see, she's a sophomore in high school. She's been riding since about third grade, but we have been leasing horses, but we've owned our 2 horses now for probably about 4 years.
And do you have them on your property, or do you have to have them at a separate farm?
No, they're at a barn because that's where the facilities are, and they have the arena and the jumping, and it's much easier to keep them there.
But it's not like you don't like rent a horse. You
No,
own it, so you could
we
take
own
it
our
any place.
horses. Yeah, we own our
Okay.
horses.
And how often do you visit your horse every day? I mean, like, how is what's the human horse relationship like outside of the equestrian activities?
My daughter, well, and I take her there. We're there probably about 5 days a week, after school and almost every weekend. We are there, caring for them and riding them and doing all the things that you do with a horse and spending time.
And when you get your horse for the family, is it do you get it as a foal, or do you get it as a fully developed horse ready to
Uh, well, our
ride?
horses are, let's see, 12 and 15. Horses need to be broken, and there are some people that start out with a foal and develop them, and but usually till they're about 9 or 10, they're not great. They call it baby brain in horses, so they can be a little bit difficult to deal with. So it's kind of a safety issue, and they need to be trained. So usually 9 or 10 is when you acquire them, unless you want a project, and there are some people that do that.
Wow. I'm just thinking about like when the horse, like I mean to think about um like something where you're getting it's somebody's had to been caring for it for 10 years before you get it, so there's a lot of investment of time and money, I think, for
Yes.
just caring for the horse just to be able to hand it to you at that right time. So it must be, I mean, it must be pretty expensive. I would imagine like that's a, it's a serious undertaking just to take care of the horse, much less than for you to take it on.
Yeah, and not only that, it's very interesting because horse shopping is quite a process because you have to find the right fit depending on what you want to do with the horse. You know, there's some people that just want a trail horse, and there are other people that want to be competitive and dressage. So you have to go shopping and find the horse that's the right fit for you. So it can be very frustrating. And there's trial periods. Like we tried our last horse that we purchased for probably 6 months. We did a lease to own process, so you get to see if it's you think this horse is going to be a good fit for you for the future. But there's a whole process of checking their health history, making sure they're sound, having vet checks, and there's still a bunch of risk associated with that because there's farriers involved. They can get injured. I mean, we've had a lot of horses that have been put out to pasture at our barn. They're one injury from not being able to work anymore, but you still have to care for that animal after that injury happens until, whenever they die, or if you find somebody else that'll take them on as maybe a trail horse if they're capable of doing that. So it's a big commitment with a lot of what ifs.
How long does the horse live for? Like, how long could you have the horse for conceivably?
Well, we have one horse at our barn that's 31.
Mm-hmm.
That's fairly rare, but usually mid to late 20s.
And is there like is there an instant like bond when you with the horse, or does it take time to get it know its personality? Like, because I imagine it has to get to trust you, and you have to trust it. So how long does that take to have that
They're all
relationship?
they're all different. They're like dogs. Some dogs are,
Mm,
more snuggly dogs, and other dogs don't really care. They're very similar in that respect. The relationship in terms of a rider and a horse typically is about 6 months before you really get a good feel for them.
it's funny that if you think about like 120 years ago, 130 years ago, that's how people got around, was horses. They were everywhere, and now the cars are everywhere, and the horse is really just kind of like it's a. I mean, it's I guess it's something special to be able to have your own horse.
Right.
Whereas,
And it's interesting that used to say, you used to be very well off if you had a car back in the day. Now you're considered well off if you have a horse. It's kind of a
yeah,
role reversal situation. So,
yeah,
and the talk with all the gas prices going up recently, everybody says, "Oh, I'm going to get a horse and take a horse to work now because it's going to be cheaper." And my daughter says, "Those people have no idea how costly it is to have a horse."
wow. There's an interesting thing that I read about New York City, which was like at the end of like the 1800s, one of the biggest problems they had here was just dealing with all the horse manure,
Yes,
and try as they might, they could never come up with a solution until the car came around and solved that problem pretty quickly.
yes,
So I don't necessarily think like, I guess when we have problems in like current society, we should just say, well, we'll just wait for something to come up. But I think like human ingenuity oftentimes seems to solve the problems from an unexpected direction.
yes.
Is at least that's the lesson I take from that. So we'll see what happens, what's in store for us in the next 10, 20 years.
Well, it's like kerosene used to be the product that everybody wanted, and the bad byproduct that they didn't know what to do with was gasoline. And then
Mhm.
that all switched around when gasoline was the commodity we needed more, and then we had kerosene, which we didn't use anymore. So it's
Yeah,
interesting how progress happens.
yeah, yeah. And so you had mentioned that the changes in dentistry. Is that been all like technological as far as like being able to like mill things for your like at your office, or what other changes have you seen?
Mostly it's technological. I mean, there's been so many advancements with it's mostly digital x-rays. I mean, we expose patients to less radiation and we can get more information now. It's quicker. We don't have to worry about disposing of solutions that we used to have to do to develop film. We don't have to spend 10 minutes developing film. It's instantaneous. Just scanning instead of taking physical impressions. That's helpful for people that are gaggers and don't like things in their mouth. But it's really speed and precision. Precision has gotten so much better with the digital era in dentistry. But it is interesting. We still do the same old thing. People say, you still have to give me a shot to put my teeth to sleep. I go, yeah, we still do the old fashioned shots. We have a lot of other advancements, but there's no way around that one.
Yeah. One of the most heroic things I've ever seen was my 5-year-old son was he had to get a tooth extracted, and they gave him the Novocaine or whatever was supposed to happen, but then, and I don't know, maybe they shouldn't have been doing this, but like they had to wrench it out, and they, it still had the roots in, which I'd never seen before, because usually when the teeth
Yeah,
come out from the child, you only see like the little cap of it,
right.
but I saw the whole graphic thing, and I mean, Atticus, bless him, was like so brave to get this tooth removed, and to this day, that was the most, I guess, I don't want to say brave, but it was the most impressive endurance of pain I've ever seen. Um, but how often do you have to do that, where you're like ripping a tooth out of somebody's mouth?
I don't like to use the word ripping, but yes. Uh, I,
That's what us lay people say.
if you think the roots on that baby tooth were something, you should see them on an adult tooth. They're pretty impressive. A lot of times we have to section teeth to get them out to make it easier. But I pull out teeth almost on a daily basis. Um, one of the interesting things we have that a lot of my patients appreciate is we have a reversal agent now. So a lot of people don't like that numbness sensation that lasts for 3.5 to 4 hours afterwards. And especially on children, it can be difficult because they tend to play with it. It feels fat and they chew on their cheek, and but then when the anesthetic wears off, they're a mess. They're all bruised up and the inside of their mouth is raw. So, and my patients like it because they can go back to work and their face isn't slumping and they're not talking funny because they're numb. So we have a reversal agent for those kinds of things, which is amazing. So I pulling teeth is it's funny. I feel bad for it, but I really enjoy doing it.
Mhm.
It's interesting when patients say, "Oh, I've had some gentlemen that have said, you can't. There's no way you're strong enough to get this out. You're just a woman. You can't get this thing out. There's no way you're strong enough. Just watch me." It's not really about strength. It's about technique.
Uh-huh.
And I love that when people are surprised at, "Wow, you got that out of there." Yeah,
You just got to put the wedge in, and it's all about physics.
right, right. It's all technique. Now the problem is with extractions is we get you numb, but I can't stop you from feeling the pressure. There's
Yeah.
always a lot of pressure, and sometimes people confuse pressure for pain. And once I explain that to them, then they understand it, and it's not as scary. But I have a lot of patients that I have to sedate. I have an anesthesiologist come in because they're so fearful or they're a gagger, and it's just so much easier to do the work, especially after the pandemic. We've had so many people that have neglected their mouths for so long. I've had a big influx of doing large cases with an anesthesiologist, and then they wake up and it's all done, which is nice.
How was your practice during the pandemic? Were you still seeing people? How long did you have to shut down?
I was shut down for a little over 3 months. It was crazy times. Regulations were coming from different different organizations. I had the FDA telling me things, the CDC telling me things, the dental board was telling me things, the California Dental Association. So, and nobody really knew what was going on. So it was crazy, but it was an education for my patients. We've always had universal precautions in dental offices regardless of what it was. Everybody was supposed to be treated the same. Everything is disinfected between patients. Everything is sterilized. Everything that can't be sterilized is disinfected. And patients would come in and they'd ask me, well, what are you doing differently because of COVID-19? And I said, to be honest, the girls in the front office are now wearing masks, and we got rid of magazines and we're disinfecting the waiting room. But everything in the back has stayed the same because we were always using universal precautions to keep our patients as safe as possible from cross contamination. There wasn't really anything more we could do.
Do you find like when the topic of masking is obviously complicated, as are a lot of things these days, but when I think about like people going to hospitals and going to visit their doctors and like wearing the mask, it seems like that's something that almost like is advisable. Like I expect, I guess, when I go to the dentist or the doctor, that of course I'm wearing a mask in there because of all the health implications. Do you is that something that you like are you see the opportunity to continue doing, since like I guess people are more like, prepared to do it?
You mean the general population wearing masks?
Well, just in terms of like your practice, like are there things like you mentioned some of the precautions you're taking now? So do you find that like would it make sense for people to just be wearing masks when they come into like a place where health care is happening, like in a dentist's office or a doctor's office, no matter what, or
Well,
do you see things going back? Yeah.
In California, it's still mandated in all medical facilities that
Hmm.
people are supposed to be wearing masks when they come into the office. The changes that we've had is, like I said, my front office staff wears masks now, and we don't take our masks off in between patients. I would usually, if I met a new patient, I wouldn't have a mask on. I would only wear the mask when I was doing treatment. Um, that's been long gone out the window for a couple of years now.
Hmm.
Um, but and we use N95s in the treatment areas because that's the mandate that we have as well. Because I don't know if you know, early on in COVID-19, they were really talking about don't go to the dentist because of aerosolization of the oral fluids. They were very fearful of people catching it or contaminating other people because it's in the aerosol. And I mean, it was crazy. My hygienists were afraid. Everybody, my patients were afraid. Everybody was afraid to step foot in my office because they all thought they were going to be exposed and come down with the virus. Interesting thing is, as things progressed and we started to go back to work, and we were staging things so that we didn't have patients sitting in the waiting room together, and making sure there was time for aerosolization in the rooms to settle down. So we were alternating rooms, doing everything we could possibly think of. Um, none of the people in my office came down with it. None of us, assistants, myself, uh, the hygienists who are exposed more than anybody because they create more aerosolization cleaning teeth using what we call an ultrasonic. Nobody in my office came down with it until years later, and we determined they got those when they were at home on the weekends and visiting with friends and family or whomever. Um, and there hasn't been an increase in the number of dental office staff contracting the virus. I know we all would have heard from the CDA or the ADA that it's at high risk, be careful in the dental offices, and we haven't been getting it. So, to me, that tells me the precautions that we take in the office works to help prevent the transmission of COVID-19. My patients were afraid to take their masks off when they come in. And I said, listen, the people that are at risk are me and my staff. You're the one not wearing your mask. You can't contaminate yourself. Once I explained that to them, they're like, oh, well, that makes sense because we're wearing masks, so we're not exposing you to our oral solutions or any of that kind of stuff. But it really hasn't been a big problem in dental offices, which was the big scary thing when this first came out.
Yeah. Yeah. Well, I tried to like when this all this unfolded. I mean, and I think there's an emotional element to it. But I tried to kind of just check myself to remind, like I was a history major. I'm like this. It's been 100 years since we've confronted a pandemic like this. So people are kind of like feeling this as we go. So there was I always tried to be understanding as much as I could about the kind of the changing advice and anxieties and missteps or not missteps that were happening, because it's been hard. And I think we see now in New York, like kids are going back to school and things are as normal as they've been, but there are like little like first graders or second graders that don't know about going to school without a mask
Right.
because they're just so used to it. In fact, they don't want to take it off. And like for my kids, like in middle school and high school, like there were kids who had been in high school for a year and a half who just never not worn a mask, and there was like a lot of hesitancy about taking the mask
Yes.
off because being a teenager and self conscious, there was like a lot. I don't want people to see the other half of my face. So
Hmm.
there is there's a lot of adjustment coming out of this as well
Yes, there
going into
is.
it.
There is.
Yeah. So, but are things for you more or less back to normal, and I mean for you personally and professionally?
Pretty much. We're very busy playing catch up from all the people that haven't been in. But I enjoy that. The 3 months that I was off was terrible for me. And if I didn't have the horses, it would have been very emotional and difficult for me to get through those 3 months. It's hard enough when you don't have an income and coming in, and I'm worried about my 6 employees making ends meet and my practice surviving, and there isn't anything I can do about it. So the one thing about horses is when you're riding a horse, you can't think about all that other stuff because if you do, you're in danger. And I like that it gets me away from the worries that I had during COVID-19. But things are getting back on track and people are less and less afraid to come in. I mean, it hasn't gone away, but it's definitely much, much more normal.
Oh, that's good. And when you go out with your horses for those relaxing rides, like, do you have? I guess there. How far? Like, you do you live in the suburbs? Do you live in the
I
country?
live
And I
in the
assume your
suburbs.
horse stable is in the country. Okay.
Yeah,
And how far away is your stable?
it's about 10 minutes, 10-minute drive.
Okay.
Yeah.
And then from there, you're able to just kind of take your horse out for a ride wherever you need to.
Yeah, we go in the arena. I'll either have a lesson or we do what we call hacking, which is we're not jumping, but we're just taking the horse through the movements of walking, trotting, cantering. They do different maneuvers based on the signals that you give them. So just training rides to keep them fresh and to give them exercise. And then we also have trail rides out there.
Hmm. Well, that
And sometimes
I
giving the horse a
go ahead.
bath. I mean,
Really? Is that I mean, is that dangerous? Do you have to worry about getting kicked by the horse or?
not with our horses. Our horses are
Uh
pretty good with that.
huh. That must be. I think there seems to be something very primal about the idea of like looking at a horse's coat,
Hmm.
and feeling it, and there's something also like I think from maybe from I don't maybe it's just never growing up with like animals, but I think as I've gotten older and I look at these kind of like these beautiful creatures, and it could be even at the zoo. It doesn't have to just be a horse, but there's something really breathtaking about these animals. They're not humans, and they're big and they're majestic.
What one of the things I love to do on the weekends when there aren't many people at the barn is we'll take either of our horses and we just let them run in the arena and encourage them and just watching them want to they're animals that are built to run and run free. And I just the one horse we have is a retired thoroughbred from the track and he just loves to just bolt and run and sometimes he'll even jump over the jumps all by himself. But I just enjoy watching them move and be free and you can see the enjoyment in the animal's eyes. He's having a blast just getting out and having nothing on him. No, no harness, no saddle, no bridle or anything. And it's just enjoying the animal for what he is and what he's built to do is amazing.
Do you go to horse races at all, or how do you feel about that as a horse lover? I don't know if it's a good
Um,
thing, bad thing.
I haven't been to a horse track in years. Probably when I was in high school, I went to the track, and I would never go to bet. I would go to appreciate the animals and see them because they're just so beautiful. They put a lot of strain on those animals, and I love the fact that I have a retired thoroughbred because they used to just destroy those animals, but now they're trying to repurpose them and give them a life. And our horse Rollo, he's wonderful, and he loves his work, and he loves to have a job and have something to do. But you see a lot of injuries. There's been a lot of problems in the horses out here. I don't know if you've heard about a lot of the horses that haven't been put down because they've broken legs on the track, and I think that's tragic. But I think there are a lot of responsible people that are in the industry. It's just an unfortunate thing sometimes when people push the animals a little bit too far. I think when they're too young and they're not developed enough, and it has dire consequences for the animal.
Yeah. Huh. Well, I mean, there's like Belmont nearby here, so every once in a while, when I think about it, like now, when the topic of horses comes up, it makes me think I should spend a day and take in the scene of the horse racing and just kind of appreciate them for what for their speed and their
Right,
elegance, and let the kids see that.
right.
So, well, do you ever come out to the East Coast?
Rarely. I have never been to New York. It's on my bucket
Uh,
list, though. It's someplace I would like to go. I mean, I've been to Florida and I've been to DC and things like that, but I've never been to New York, and I definitely want to do that.
Okay, well, you've got a contact here.
Awesome.
We've been here since '97. We were living in Japan at the time. My wife got into business school in New York, so we came here and we've been here since.
It's a different lifestyle than what we do here. Things are on a smaller scale for you in terms of your
Small.
home.
Oh yeah, yes, yeah. It's we had so the five of us share like an 1,100 square foot apartment. And in the early days of the pandemic, when there really was no place to go, the playgrounds had been closed, the schoolyards were closed. It was a challenging couple of months for sure.
See, I live on a half an acre, and I can't see the house next door to me, and we enjoy the space.
Yeah, yeah. Well, I think what one of the things for me personally is like I think I'm a pretty introvert. I'm an introvert by nature. So for me, having so many people on top of me is like a good thing because it helps me not be an introvert. Because I think
Okay,
if I did have a lot of space, I would just kind of go down my own little like mind, and I would never get out of it. So having a lot of people kind of forces you
right.
to interact, at least for me.
Yes, true.
So, and then there's the convenience of like our kids can walk to school in like 5 minutes. I mean, my daughter's she takes the subway all around the city right now. I mean, she's 16 and she can go anywhere, and like I'll pick her up at night when she's out. But otherwise, I mean, it's like free range childhood, and you've got the whole city.
Nice, nice.
Yeah. So, I mean, you definitely learn a lot. I grew up in the suburbs of New York, so like I know what that life is like, and it's easy to kind of see how kids live like that. But I've seen how it is here, and it's usually like kind of baby steps. It's not like you go from just kid not doing anything to all of a sudden they're taking the subway to 5 miles away, and like the Upper West Side from Brooklyn. It's taking the bus to middle school, and then taking the subway a couple of stops to middle school, and then meeting a friend in a different neighborhood, and then it just kind of goes from there.
And we don't have public transportation like that here. Here, you kind of have to drive yourself everywhere, so it's a lot different, a little more
Yeah.
difficult.
And I guess there's no horse paths along the street.
Actually, I have a horse trail across the street from my house. I live in an area where there are a lot of horse properties, so
Really?
kind of nice to see horses walking down my street every now and then.
That's one of my favoriteest places that we ever lived was we lived off of Central Park, a couple blocks away. But where we lived, the horses' carriages would finish their night, and they'd walk like down our block. So you could go to sleep at night, and you would hear
The
like the
feet. Yeah.
clip clop of like horses, in addition to the trucks and the ambulances and the fire, the trucks and the ferries and the trains. So it was kind of like you heard all modes of transportation just from that little apartment.
Yes, yes. Those are amazing horses that can tolerate the big city like that too. They're what we call bomb proof.
I've never done it. That's one of the things. That's one thing on our bucket list. Is I think as a family we definitely need to do that at some point.
Isn't that funny how we all do things? There are things that everybody comes to our town to do, but we never
Yeah,
do it when we live in that town. Like you getting on, everybody goes to Central Park and gets on the horse and buggy ride, right? Here,
yeah,
everybody wants to come and go to Disneyland or Malibu and go to the beach. And I can't tell you the last time I was at Disneyland or went to Malibu to look at the beach, and it's only a few
yeah,
hours away, or a few hours, a few minutes away.
yeah. So what is it? Name something like in your area that you've never done that you feel like you should do or want to do.
Something in my area. Well, there's a lot of things. Like I said, I'm originally from San Diego. I haven't been back
Mhm.
down there in a long time to enjoy some of the things that San Diego has. Like we used to call it the Wild Animal Park, which is an association from the San Diego Zoo. But I've never been to the Los Angeles Zoo. Um, it's just interesting. The things that everybody wants to come here to do, we never do when we're here. I mean,
Yeah.
everybody loves the beaches here. Well, I'm also lighter complected. I don't do well in the sun, so I don't go to the beach. But I appreciate going to see the ocean, but I just never get a chance to do it because I'm just so wrapped up in my life, working and spending time with the horses that I never get a chance to go to the ocean. It's only a few minutes away.
Do you go to the wine country up nearby?
Yes, I have been to the wine country. A lot of it up in Santa Barbara, and I've been up to
Mm,
Napa a few times. That's quite
yeah.
enjoyable.
Yeah, yeah.
Uh,
There, there's some. We went while we were out there a few weeks ago. We went. We've never gone to. We were starting to look at like colleges for the kids.
hmm.
So we went to like Pepperdine,
Oh yeah,
and
what an
just to
awful
see and just to
location, huh? Isn't it ugly?
yeah. Wow. Like I mean, it was glorious to like
Beautiful.
go. And I went to school in Philadelphia. I mean, and that was a nice campus, but like to have that vista where you're looking out at the Pacific Ocean and the California coast for like 10, 20, 30 miles was just
It's
made me want to
spectacular.
become an undergraduate again.
It is spectacular. But when we have the fires here, Pepperdine was in the middle of a bad situation a few years back, but everything was fine. But it is
Hmm.
absolutely breathtaking. You're absolutely right from that campus.
Yeah. Yeah, no, that's the one of the things that I've been trying to be conscious of is like how I guess everybody like we all live these different lives in these different areas, and to try to just get to I guess understand how other people live and think about those. But it's interesting you bring up like the tour sites because somebody can come to New York and you can go to all the different tour sites. You can go to the Statue of Liberty, you can see a Broadway show, but as you're saying, like oddly enough, like that's not the average New Yorker's life. Like
Right.
you can go there and you might see a lot of cool sights of New York City, and it's great for New York City to have people coming, but you don't actually understand how New Yorkers live at all.
Yes.
So, and I think it's like going to California and think that you went to Disneyland and like, oh well, I know California. Like you don't know it at all.
Right.
But I think the one of the things is just even like having that awareness is kind of a useful thing, just to realize that even though if you've been to some place, you don't necessarily know it unless you've kind of gotten to talk to the people, which is why we're doing this podcast.
Right. Exactly.
Yeah. So, well, I guess we're kind of getting to the end, and I'm sure you have other things to do. But before we wrap up, can I ask, like, so what gives you hope at the end of the day?
What gives me hope is part of the reason I like being a dentist is I get to interact with a lot of people and I get to meet new people all the time. And it gives me hope when I see people overcome their fears or their anxieties, especially which I see on a daily basis in my office. I mean, I had a patient recently that hadn't been to a dentist in at least 20 years and needed some major work done because she was having a reunion through college and she didn't want to present herself the way her teeth looked. And I redid her whole smile, everything under sedation. She came in actually yesterday. It's the first time I had seen her since I'd completed the work, and she was, fully with it because she wasn't sedated. And I walked in the room, and she had a smile on her face, and I had never seen her smile before. And I said, "What's that on your face?" She said, "It's a smile. I smile all the time." That's what makes me feel good. Is I had a positive impact on her life, and she overcame her fear to actually come in. She interviewed me before we started anything, and she felt comfortable with me. So I have hope that people will overcome their fears and challenge themselves and better themselves. And then you can also, in return, do that for other people. It's passing it forward and helping other people, and then they continue and help other people down the road. And that's what gives me hope.
Yeah. That's wonderful. Thank you. Wouldn't know where, like, what insight you would have from your profession, and that's a really special one. So thank you very much for sharing that.
I love seeing people
And
smile that haven't smiled in a long time.
yeah, yeah, we could all use more smiling
Right.
in general. So, all right. Well, thank you so much, Jacqueline. It's been a real pleasure getting to know you and sharing the conversation with you. So, thank you very much.
Thank you.
All right. Take care. Have a good day.
You too.
Thanks.